My name is Dallas Nicewater. I'm a nursing 1119. We're going to go ahead and do a root scan. Alright, so I check my patient's chart for orders and allergies. I perform my hand hygiene. I provided privacy. So now, my name is Dallas. I'm going to be your student nurse today. We're going to go ahead and identify him. I'm going to use armband, name, and date of birth. Alright, so today we're going to be inserting his nasogastric tube. Do you have any questions about that? No? Great. So I'm going to get started. I would go ahead and have my suction available. I'm just going to go ahead and put on my gloves. Clean gloves.
Okay, so
over my patient. I'm going to have this available just in case. Alright, so the first thing I want to do is I'm going to go ahead and check the nasal cavity for any kind of obstructions. And I'm going to inform my patient if they have any like severe discomfort, if they want to try to tap me on the shoulder or raise their hand, and that's the way they'll communicate during this procedure. And also if my patient was to ever become cyanotic, not be able to speak or hum, if I wasn't able to advance it after I rotated, or if they had any continuous coughing or gagging, I would just stop this procedure. So now we're going to start. I'm just going to go ahead and connect this. Alright, first thing I want to do is measure.
Take a little paper off, put that little.
Alright, and then I'm going to mark with a permanent marker. And then we're going to leave this up.
The 13 mark. Then I'm going to put back there to make sure there's no kinks. Then I'm going to just go. I got the ear. Okay. Let me go ahead. So I'm going to have a tube out. I'm going to measure. Then I'm going to take it. I'm going to take this thing, take a little piece out, put it in there.
Alright, after I got to this point, I would give my client their water, and I would have them tuck their chin down, and every time they swallow, I'm going to advance it down.
Squirt it out, and then put 40 things of air in there. Put the air in there. So then, wait, I'm not supposed to have a kink at this point. I'm a kink it, do the gastric thing, unkink, put it in there, put the air in there. Then I'm gonna kink it again because I'm about to put it on the suction.
Alright, so I got it to the mark. And then I'm going to check in the back of the throat for any pulling.
Put the nose piece thing on there, wrap it around.
And then I'm going to get the gastric fluid out. Plant this.
Take the little cook bag.
I'd pour this in here and then use a pH strip to test for pH. And then if I would go ahead and
I'm going to take those gloves off. I'm going to help them to a good comfortable position.
we're going to tape it, attach it to the gown, and then we're going to hook it to the suction only if it's ordered. And then if this was used for tube feedings or medications, I would have to get an x-ray to verify that initial placement. Alright, and then I would also want to help my client with oral hygiene.
Take a little tape. And then,
Alright. Alright, so I'm going to clean all of this up, and then I would place my patient back, lower the bed, place him back into a safe position, but I would keep the head of the bed at least 30 degrees. Make sure they're safe, have their call light within reach. I'm going to take these gloves off, do my hand hygiene, and then I would document. Alright, so now we're coming back in, and now it's time to remove it. I would do my universal beginnings. I stated at the beginning of the video. I'm going to let my client know, now it's time to remove the tube. I'm going to put on my clean gloves. And I cover up my client, make sure they have an Emerson and facial tissue nearby, also water's the case. Alright, so now I'm going to turn off my suction is the first thing I want to do. I'm going to go ahead and untape this, unhook this, and then what I would do is this would be clamped off. I'm going to take 40 mLs of air, and whenever I do this I'm going to instruct my client to hold their breath. So we're going to clear it.
Let me watch the video. That's what I'm about to do.
Alright, and then as I'm pulling it out, and I just want to look at my tubing and make sure there's nothing abnormal on there. And then I would discard this per my facility instructions.
And I'll put this back in there, right?
And then I would take off these gloves, put on some new gloves, new clean gloves, and then I would assist them with their oral and nasal care. Make sure everything's nice and clean. And then I would check for my suction canister, and I would measure it and empty it. And before I go, after I clean everything up, I'm gonna put my patient back and lower the bed in a safe position. Make sure they're safe, have their call light within reach. I'm gonna perform my hand hygiene and then document. And now we're gonna do another room scan.